Welcome to the panel on data and digital services. I'm Bleddyn Rees, the chair of the Digital Health Society, and it is my privilege to introduce you to our distinguished panel, all of whom are council members of the Global Health Connector Partnership. So Professor George Margelis from Australia. George is a medical practitioner who has been deeply involved in technology for the last 30 years. He has worked for Intel and GE Innovations. He chairs the Aged Care Industry Information Technology Council. Professor Rajendra Gupta from India. Raj is a leading international public policy expert and advisor. He has served as CEO, COO at Fortune 20 and Fortune 500 companies in India. He advises many global organizations, including the UN, the World Bank, the Asian Development Bank, WHO, the World Economic Forum, and the ITU. The format today is 3 questions. So starting with the first question, what are the key challenges your health system faces to recover from the pandemic? George.
Thank you, Bleddyn. And first of all, I'd like to say thank you for the invitation and welcome to the people in Miami, all the way from far away Australia. I wish I was there with you, but unfortunately, circumstances go beyond that. Look, our biggest challenge is workforce. Workforce was an issue before the pandemic. It's now become a critical issue here. For the first time in decades, our nurses actually went on strike last week. And in aged care, it is predicted we will have 100,000 plus shortfall in the near future. Recognizing how important it is to transform the sector to build its resilience and its sustainability, it is significantly hampered by the fact that the workforce is under such great pressure. So they have to deliver care now and don't have the reserved capacity to also implement change. The other thing the pandemic highlighted was the need for better, more accurate, and more importantly, more timely data that is captured in the process of delivering care rather than posthumously. I'd like to talk about real-time data of how the system is coping versus autopsy data after the system has collapsed. Well, that will enable us to respond to future crises. And finally, scalability. We need to be able to scale across our systems and our services. We saw that with COVID, and even though Australia was relatively mildly hit at the early days, our healthcare system and our aged care system still struggled, and we still had the issue of the majority of our deaths coming in our aged care sector. So that ability to triage services to ensure those at greatest risk can get the services they need, whilst those at lower risk can utilize digital services to fulfill their needs and allow those physical resources, which are so limited, to be utilized effectively. So those things really challenged our healthcare system during the pandemic. We did a relatively good job. We have one of the lowest death rates in the world. We have a fairly good response rate, but like everyone else, the 2 years in isolation and the struggle it's caused and the workforce dilemma of just surviving in the system has been a real challenge.
Great, thanks, George. Raj?
Thank you. And it's a great opportunity always to be representing the Global Health Connector Partnership for the work that is done to impact the global healthcare. I think I'm so fortunate to be a part of that. Now, my first point would be that pandemic didn't do anything new to us. It only did one thing. It masked us and unmasked the reality of healthcare, the broken healthcare system. So what you see is what existed. It only tested it. So in my country, if you ask me, we had 500,000 deaths, not a small number by any chance. Worldwide, it's 5 million. What I felt in our country was the biggest challenge was, I think my previous speaker, Professor George, said, human resources, yes. More than that, we also fall short on investments in healthcare. We have roughly around 1.25% of our GDP on health. That's way too less. And this pandemic brought that to the fore. Second thing, we realized that we had spent too much time to integrate digital health into the healthcare system. So it also brought focus to the fact that digital health has to be an integral part of healthcare system, and actually got digital health the right place. And infrastructure. We really lost lives because of short of oxygen, basic medicines, and of course, at that time, the protective healthcare gear, our masks, our suits and all. But these things have also activated the political leadership to say, hey, we need to do more. So the challenges, I would not say have been overcome, but yes, now there's a definite plan to overcome. So in a sense, for the heavy price we paid, we have got on track to address the issues in healthcare which existed long time before COVID happened. It only unmasked it. Thank you.
Thanks, great. So the next question, what digital tools and innovation is your health system using to support the recovery from the pandemic? George?
There's a couple of aspects there. I mean, Australia's had electronic medical records in place now for many years across secondary, primary, and tertiary care. One thing it did see was the lack of integration across those various sectors was a challenge, but the use of the EMRs enabled us to capture some very useful data for our ongoing evaluations of COVID care, and also to get us a better understanding of the challenges facing it within the facilities. Telehealth came to the forefront, and in many situations it delivered great value. However, it did demonstrate some of the equity issues around access and technology that are part of our system, and that those who had access to technology could have access to healthcare services, and those who didn't still had to find ways around it. One rather disappointing aspect from a technology perspective was that the vast bulk of telehealth was delivered by phone rather than video. And however, we did see a significant uptake of video in some sectors and a significant growth of a couple of telehealth companies, both in the clinical space and in the technology space. And we're now just watching to see where they end up post-pandemic. So we had a growth in telehealth. It's something we've been talking about here in Australia for decades. I mean, Australia's had a distance problem from the word go. But we found now that telehealth is having a service, but it's evolving to a more technologically advanced state is a challenge. Remote patient monitoring also came to the forefront, slower than I would have liked. And we saw the development of things like virtual hospital wards, a concept we explored well over a decade ago with some of the hospitals who back then thought it was something they would never need. And today have rolled out whole new virtual wards. Many organizations have taken some of those old innovations and rebranded and relaunched them. So I guess to some degree, imitation is the highest form of flattery, but it is frustrating that ideas that have been around in the market for many, many years needed a crisis to evolve. I mean, these things were highlighted many years ago. Some of the work done by people like the Continuum Alliance and the Personal Connected Health Alliance have been sort of visible and available for decades, and yet we had to sort of jump on it, wait for a crisis to develop. I guess the last thing is data analysis. We actually had for the first time people seeing statistics on the nightly TV, and those of us in the healthcare space getting daily epidemiological reports and digging into the data, and the desire to dig deeper into the data became a large part of that. So we started to develop a data culture where we wanted to see the relevant numbers, and we wanted to see the relevant numbers on a daily basis, not a 6 months post data information. And that's also led to a bit of a growth in the use of artificial intelligence and machine learning. So with all that data, we now have that challenge of how do we analyze and how do we utilize that data. And we've seen the growth of a strong machine learning community here in Australia to look at that data and analyze it and look for trends and enable us to take those trends and hopefully use them to make better decisions going forward.
Great, thanks. Raj?
Thank you. So I would take back a little before the pandemic, this our current Prime Minister had a vision of digital India, but as I said, the health is always in a state of inertia in terms of adopting technology. But what came in handy is since his taking over as Prime Minister in 2014 and the second term in 2019, there was a complete plan for using digital health. There was a national health policy that came in 2017. So what has happened is the moment this pandemic struck, immediately within weeks, we released the National Telemedicine Practice Guidelines. So what was lying for a decade, I think George very clearly said about Continuum Personal Connected Health Alliance, and I had a chance to be president of both, including HIMSS in India. We did a lot of work over the decade, but finally pandemic brought that to practice. The second thing we did was we in India created an institutional process. So we have set up a National Health Authority. We have set up a Ayushman Bharat Digital Mission, which is the world's largest mission. So we immediately came up with the COVID app. That app was downloaded 200 million times. It's given free for the countries who want to take. So all of our COVID vaccine certificates are online in our app. So we adopted technology at scale thanks to COVID. We also had eSanjeevani, our national telemedicine platform that did 140 million teleconsultations. So if you really look at, we have a unique health ID, we have a complete telemedicine practice brought from the government guidelines, a complete institutional setup. to use digital health. We have created various registries for healthcare facilities, for doctors. So I think we are on a path to be becoming a country with digital health first. And that to me is the biggest achievement, having been part of the policy to make the country prepared for what's doing today. And I think COVID has a big reason for all this being fast tracked, which was lying with us, which didn't act. So I think this actually becomes innovation, but it was more of a compulsion and a basic need for everyone. We may call it innovation, when we look back, but it's actually now a basic need.
Great, thank you. And then our final question, how do you see data playing an important role to support the recovery of your health system? George?
Well, and like I said in my earlier question, the recognition that data is critical for us, for our decision making, is it's been highlighted by the pandemic. And once exposed to the value of the data, more healthcare policy makers and executives have recognized how they can use that data to make decisions. What it has highlighted, unfortunately, is the quality of data, which sometimes hasn't been all that great. So the need to provide greater efforts to ensure the quality of data is important. The timeliness of data has also been highlighted. We need to invest in technology to facilitate the timeliness of data so we can get data in near real time rather than batch data in post-event. One threat that has been exposed has been the uninformed or sometimes purely vexatious use of data to suit various agendas. So the need for education about data and the related science of statistics and how we analyze data is important. And I think that's really critical for our healthcare sector going forward, for us to better understand how to use the data and how to analyze the data more effectively. And that also leads to a greater transparency around the data. At the clinical coalface, access to the individual as well as system-wide data has been very important. Clinical decision-making has been rattled by the dynamic nature of this pandemic. We're used to relying on gold standard data published in guidelines, but this pandemic showed us that there is no guidelines around a rapidly evolving viral disease. So we had to respond at breakneck speed, and that ability to access that real-time data, things like pre-press servers, which didn't exist 10 years ago, now are becoming our primary resource. And how do we access that data, but also how do we feed data back into the system so that we have ongoing clinical evaluation of what we're doing? We need to maintain our caution around how we use that new data sources, but we also need to help our clinicians understand its value and how we can use it in real time to make clinical decisions.
Great, thanks. Raj?
Thank you. So when it comes to data, the book that I wrote, Digital Health Truly Transformational, I put this quote that medical science will be driven by data science and to be partly replaced by data science. That's the future, if I have to put succinctly in one line. But more than that, when we get super excited by using words like AI and big data and ML, we need to first solve the problem with data and then try to leverage data for solving our problems. And I think the starting point for that is at least get your basic data first, which is EHR. We can't daydream about AI without having EHRs in place, everyone using them, that's one. And then the biggest thing that comes in is the interoperability. If it is not interoperable, it is half your problem solved and a bigger problem created. So instead of big data, you have a bigger problem. Now, having said that, for a country like India, which kind of represents today a group that is lower income and lower to middle income countries, if I were to club them together, it is 6.7 billion of the entire 7.9 billion population. So for that, just imagine the role data can play. It can actually be partly feeding you in primary care. In the UK, if you see the MRCGP exam, the chatbots, AI-based chatbots, they actually scored 81% compared to human doctors at I think 70 to 73%. My belief is that primary care, which will address most of the health problems, will be driven by data, which is DSS, the decision support system. So that I see as big. Second thing in our country is, where you have got tertiary care facilities in super big metros, and then your majority of population widespread. I think even the case of Australia, which is the huge land mass, with dispersed populations. So you need to filter who needs tertiary care at what time. So I think that is what data can do really, really big. It can save your human resources in terms of investing times where they don't need to, where data can filter. So I see immense use of data, but I say data has three problems: integrity, integration, and then intelligence. If you do not solve first, if you do not address second, the third doesn't exist. There is no intelligence in data. So I think we need to solve the integrity part, the integration part, and then intelligence takes over. So that is what I would say. And that's what we are all working on. Thank you.
Thanks very much. And that brings our sort of panel to conclusion. My sort of takeaway is that I've heard a lot of people say, don't waste a good pandemic. And I think both of you have brought up some important points that we've learned from the pandemic. And I think the challenge for the Global Health Partnership is to be able to actually share that and ensure that the knowledge doesn't just reside in one country, that we try to ensure that we learn lessons across the globe from what different countries have understood and learned. So with that, this concludes the panel. So thank you for your attention and enjoy the rest of the Global Health Connector and ViVE events. Thank you.
Thank you very much.
Thanks, Glenn. Great, Raj.